Unfortunately, respiratory viral illness season is upon us, and we're seeing an upswing here in Salina. I'm Rob Freelove, Senior Vice President and Chief Medical Officer at Salina Regional Health Center.
Dr. Freelove, thank you so much for joining us today. We're hearing a lot nationally about the respiratory illnesses, RSV, flu, and even COVID is still around. Let's talk about locally what the respiratory illnesses are doing for us.
Sure. Well, unfortunately, we're seeing a pretty significant upswing in respiratory illness here over the last couple of weeks, and we're on that upslope. I don't think we're at the peak of that yet. We're, in particular, seeing a lot of influenza. COVID's still out there. We're seeing some RSV as well. And unfortunately, influenza this year seems to be a particularly virulent strain. We're seeing a lot of severe illness. We're seeing hospitalizations. That's been something that's been going on nationally and has started working its way deeper into Kansas. So we're starting to see that as well here locally. With the increase we're seeing in respiratory viral illness, we have implemented some visitor restrictions at Salina Regional Health Center. Please refer to our website for further information.
Okay, now to talk about, well, we all learned in kindergarten, but what are the precautions we need to be taking to protect ourselves and our families?
Sure. Well, you know, it's interesting. We've been talking about this, seems like for about 6 years now.
Really?
Yeah, and there's simple things, right? Good hand washing, avoiding touching your face and mouth and nose. When you're sick, stay home. If you do get sick, contact your provider. There are, for certain, at least for influenza and COVID, there may be options for medications that can help reduce the severity of illness. And vaccines. There's vaccines there's flu shot, there's a COVID shot, and there's actually an RSV vaccine. And it's not just for infants, it's for adults as well. So in particular, if you're very young, you're over 65, you have chronic disease or illnesses that affect your immune system, you should get vaccinated for all of those. It may not prevent you from getting them, but it can help prevent it from being serious illness and avoid hospitalizations and even death. And it's never too late. Right now, I mean, the ideal time to get your flu shot is in October, early November, but it's never too late. Flu season goes all the way potentially to May. So it takes about 2 weeks to really get a good immune response. So if you haven't been vaccinated, you should get out there and get vaccinated.
Okay. Thank you so much for some great information, and thank you for watching. For more information, visit srhc.com, like us on Facebook, follow us on X and Instagram.
More of Good Day Kansas after this.